Hi, my name is Emily Sillis, and I am the host for the Sage Holistic Show. Today I'm excited to share with you Joe Reed, who is a personal trainer. But he's not just any personal trainer. He has a business called Train Out of Pain. He focuses on helping people who have chronic pain, chronic fatigue, fibromyalgia, and so much more. He's going to talk today about how movement is medicine.
Sage is a 501(c)(3) nonprofit organization building community by providing education and counseling about physical, mental, and spiritual well-being. We encourage all of our listeners to find their own path to what holistic wellness means to you.
So yes, my name is Joe Reed. I am a personal trainer. I'm also a health coach. My business is Train Out of Pain, not Train Out of, but there is an A in there. I am a personal trainer who specializes in helping people that are in pain. Yes, I still work with, general populations. I've worked with everybody from last year's Japanese Basketball League MVP to his brother, who's probably going to be drafted in the NFL next year, to every soccer mom you could think of. My youngest client right now is a 9-year-old, and my oldest client right now is 78. I've worked from 9 to 85 years old and everybody in between. But my specialty and my passion lies in helping people overcome their disabilities, overcome their pain, overcome things in a little different way than you guys have in the physical realm. And I'm going to share my screen here and kind of get into it a little bit for you guys. So, all right, we're going to share this up here. You guys all see that screen? Okay, great. So, yep, that's me. Picture of me taken by my BNI chapter president. That is my name, personal trainer. Train Out of Pain is my business, and I am located, just like Robin, in Laguna Hills and online as well. I have trained clients as far as the UK, Canada. I have clients currently in Texas, Northern California. So as long as you're in good enough physical condition and my assessment says that, then I can work with you outside of being here personally in the gym in Laguna Hills. So this is going to be a little different presentation. I'm going to talk about what I do a little bit today, just because you've probably never heard of a personal trainer like me, and you probably never will hear of another personal trainer like me again. So what my business is, Train Out of Pain, is I help people live better, move better with less pain. I have developed a different toolbox and skill set than most personal trainers due to my own personal history, which I will get into. But like I said, my lane is really helping the most helpless, the ones that have seen every physical therapist, they've seen every chiropractor, and they've kind of lost hope, and they just get whim of a personal trainer who does a bunch of weird stuff named Joe, and then they come and see me. Now, what I normally don't do is I don't help people get six packs. There are a million trainers out there who can do that. Can I do that? Absolutely. It is painful for me because that is the easy stuff. When you come to me and you tell me, Joe, I've fallen, or I've been in a wheelchair, I have this physical limitation, that challenge for me is what drives me. To be able to get somebody a six pack, that means they got to be dedicated with their nutrition and they're coming to the gym. Again, that's the easy part. Finding a way to help somebody overcome their limitations is what I thrive on. And it's the thing that drives me to continue to educate myself to be able to help the most helpless. So why do I do what I do? This is a photo of me from a little over 5 years ago. Just moved in with my wife, spent 8 hours moving, and I spent the next 4 days in bed, unable to move. I, at that time, was dealing with fibromyalgia, which I had originally started feeling symptoms from in 2011. And in 2015, of May of that year, I actually had to retire due to disability. I was formerly a warehouse supervisor for a school district for about 15 years. This was the first day that I got out of bed after moving in with my wife, and I could barely walk. At that time, I did have a handicap placard because I could barely walk, and this was my first time venturing into the electric cart or the electric wheelchair at a store. And my wife thought, this is a great time to document this, because she had the foresight to think that this was going to be something that was temporary for me, even though 30 plus physicians said that this was something that I was going to deal with for the rest of my life. And in doing so, They crippled me because I thought that not only would I deal with this for the rest of my life, there was no way that I could overcome it. There was no drug that I could take. There was no supplement that I could take. And there was no protocol that I could experiment with to find out if I could help myself. And what I did over the next, after this photo, 6 months later, I walked a half a mile for the first time and ended up exercising. I spent thousands of dollars on functional medicine testing to find out what was wrong with me, which I got no answers from, but that allowed me to do my own research to now say that I'm a little over 2 years symptom-free from fibromyalgia, and probably the only personal trainer in the world who not only has fibromyalgia, has been diagnosed with it, but who has beaten it. This is not remission, it is gone. Now, how do I do what I do? Again, I'm very, very different. I take a lot of pride in being an outlier in the fitness industry, but this is my principle, the move for more principle. And this is how I help people that are in pain feel better. I help them move more, or move yourself, move more of yourself more often in more ways and in more environments than you currently are not doing now. That is my secret. That is not a secret. I tell it to every single person that comes into me. Even during my consultation, I let them know exactly what is going to happen. It may not be, hey, this is the movement or exercise that you're going to do, but this is exactly how I help people get better. When you're moving in these ways, you have no choice but to get better. If you're a sedentary individual, if you're sitting at a desk all day, or if you're retired and you're sitting down or you're lying in bed all day, I can make you feel better very quickly just by doing this. It's the easiest way that I can help somebody feel good or make a change very, very quickly with the clientele that I have in. So what makes me different? I have these 4 E's that I like to say that make me different. Every trainer has the first 3: education, expertise, and experience. But what separates me from the others is empathy. Because I've been in a wheelchair, because I have fallen 5 times and been unable to get up from the floor, because I couldn't twist off a water bottle cap or cut up my own meals a few years ago. I understand what it's like to have extreme physical limitations. And I might have somebody come in here who has a different physical limitation, but I can understand because I have been in a similar situation, versus most personal trainers who get into this industry because they're a former athlete. They love to work out and they think they're going to work with every athlete and they're going to make them great. When you get into this industry, you realize really quickly that you work with more soccer moms and people that are in pain than you do with athletes. But that's why I love doing what I do, because I looked for somebody like me for 5 years and couldn't find somebody. And that is what really motivated me to get into the fitness industry. That, and a woman who had MS, who I actually got to work with later on, who saw a video I did, and she said, "Joe, I want you to know that you give me hope." And that's what I try to instill in all of my clients, is to create hope for them that one day they might be able to overcome their physical limitations just like I have. So I'm going to get into a couple of different things here. I want to talk about some client successes that I've had, just to show you the different type of people that I do work with or have worked with in the past. So this is my man, Ken. Why is Ken wearing sunglasses in the gym? Is it because he's cooler than everybody else? Yes, there is that fact. But the real reason why Ken is wearing sunglasses in the gym is because Ken is blind. And I will tell you that working with a blind client is very difficult. It makes everybody really easy to work with. Ken had 2 strokes in his early 40s that left him blind. And I want to tell you guys a real quick story about Ken. Ken is one of my biggest success stories. I have a deep foundation in neuroscience, and that foundation in neuroscience allowed me to impact Ken's life in a very different way. I only had 5 sessions with Ken, but in all 5 sessions, Ken's vision came back, and it came back temporarily, and it wasn't to where he could see like he did once. He would sit there and I'd see his face light up and he'd say, "Joe, it's happening again." He says, "Now every doctor that I've seen will tell you and tell me that I'm still legally blind, but I'm making out shapes that I never can. And I only do that when I see you." And I did that because of the neuroscience foundation that allows me to affect the brain and the central nervous system more than just the muscular and the musculoskeletal system. Now, you saw Ken's hair, you see mine. Do I only coach bald men? No, I don't. I actually coach more women than men, but this is another client of mine. This is Mr. Brad Park. This is another great success story. Brad was actively going through chemotherapy. Brad was diagnosed with a tumor in his chest, and Brad wanted to be proactive about his health and wanted to come in and train with me. Well, my manager sent him to me because they knew that these are the type of people that I love to work with. And his doctor said, I will not allow my patient to work with a personal trainer because most of us have a bad rap. Well, I wrote his doctor a letter detailing and outlining everything that we'd be doing with exact specifications and specificity. Doctor wrote me a note, said, you have my blessing. Please do well with him. And we trained together for about 3 months. And he is now beaten his cancer and is still doing alive. Is alive and well, and is very happy to be a grandfather newly within the last 6 months. I also coach women and seniors. I actually love coaching women. I was raised by women. So you're all in the healthcare and the mental side of this, so you can understand that. But I connect with women better than I do with men. As much as I love working with men, men have this idea because they see me. Look, I'm covered in tattoos. I look like this tough guy, which I'm not, by the way. Men take it as a challenge very differently than women do. Men think of it as a hit to their ego, where women are able to accept that challenge in a very different way. Seniors is something I specialize in greatly because of my training in balance with the vestibular system, your inner ear system. I have an extraordinary amount of education in that, and I consider myself an expert. So I do work with a lot of seniors who have extraordinary balance troubles, and that is something that I deal with and can get rid of pretty quickly with most of my clientele. Next 2 slides, I got a quick video for you guys. These are 2 of my clients that I've had the biggest life changers with, and with very simple movements. This is a client of mine who also had a stroke. He is 79 years old. He was greatly affected on his left side of his body, didn't have much energy, had no power, lost most of his appetite. And we worked together for about 3 months. And this is what he was able to do. Again, he is 79 years old, okay? You will not see another 79-year-old be able to do what Mr. Kim is doing. Oh, is it gonna come up? I might have to, there we go. Okay, so what Mr. Kim is doing is something simple here. He's getting up and down from the ground. Sounds simple enough for you and I, but at 79 years old, after having a stroke, this was nearly impossible when he and I started working together. So if you watch him, he's not using any weight, he's using his body weight and he's using gravity, but he's also using a bunch of different movement patterns that are foundational to us as human beings. And he does these very, very well. This changed his life. I got a message from his son afterwards that basically stated that he hadn't seen his father in this good a condition since he was a young boy. And his wife had thanked me endlessly after our last session, saying, I haven't seen my husband this way in decades. So this is the type of stuff that, again, it's easy, it's simple, but it changes their life in a very big way. Not only is he stronger, but falls are never gonna hurt him again because he has spent so much time on the ground. And then this is my most recent victory with my oldest client, Mrs. Warren. Mrs. Warren is 78 years old. She has had multiple surgeries, a couple bouts with cancer. He walks with a cane normally. And when she started with me, this is the one that I said earlier that could barely get up out of the chair. So this is after 10 weeks of working together. She is now seating without using her hands. And now she's getting up from a chair, from a seated position without using her hands for the first time in decades. We do really easy stuff, but it's the things that has allowed her to change her life, to allow her to tell me, Joe, I worked with a personal trainer before you for 15 years and she helped me through all of my surgeries. But in the 6 weeks working with you, I have not only found more value, but you have changed my life in such intimate, personal ways that person within 15 years couldn't have done. That spoke volumes to me. So it's the simple things that allow me to help people and change their lives on a very intimate, everyday, real world application versus, hey, you know what, Joe, I just want to lose 20 pounds. There's a million trainers in the world that can do that. So who's a good client for my business? Chronic pain, anything chronic pain, that is my avenue. If you know somebody that has fibromyalgia, I'm going to tell you right now, if they come in for a consultation, they're probably going to get me teary-eyed. Fibromyalgia is the one that really pulls on my heartstrings along with chronic fatigue syndrome because there's a lot of parallels between the two, and I've worked with them significantly, and that's where a lot of my education and research has gone to. Desk workers, you guys might know a couple of them. You might even be one. A lot of people are sedentary these days, and we got knee pain, hip pain, back pain. Those are the things that I work with all the time, and they're pretty simple for me to work with. Stroke victims, they're some of my favorite people to work with because I can impact their lives. Usually within 3 weeks, they see a change. Not only do I, but they see a change within 3. I've worked with a few people that are blind, anywhere along the disability spectrum when it comes to a physical disability to, somebody that's recovering from a hip replacement surgery to somebody that has a severe autonomic nervous condition. I've worked with it all. I've worked with several clients on the autism spectrum. I have some very specific training as well to get rid of some of the primal reflexes that some of the people in the autism community hold on to, which is something I take a lot of pride in. My stepdaughter has high-functioning Asperger's, and I've helped her with a lot of different things in this arena as well. Anybody that's got any type of chronic illness or autoimmune disorder, seniors, and people that have balance issues and vertigo, again, that is something that I specialize in, just as somebody who was a physical therapist that specializes in the vestibular system and who's a good referral partner for my business. Doctors that work with people in pain, especially chronic pain, naturopaths, physical therapists, massage therapists, other personal trainers, because like I said, if you have a physical goal, if you want to lose weight, or if you would like to get a six-pack, I then refer you to them. As much as I like money, money doesn't drive me in my business. It is actually an altruistic place that I try to come from because I want to help the people that have lost their hope, just like I did a few years ago. Chiropractors are another great one for me. Personal injury attorneys, and people that deal with senior care, whether it be in-home health care or in-home care, which are two different things. In-home care being if, let's say I had a hip replacement surgery at 42 years old, that would fall under in-home care. Well, in-home healthcare would be different in that if I had that replacement, or if I were a senior, if I had some different issues that I needed beyond physical therapy, that's where I recommend in-home care, it would also be for different things like someone coming in and cleaning up the house, doing chores around the house. People that deal with seniors are also a great referral for my business. So I want to thank you guys for sitting here and listening to me vomit about my business for a few minutes here. I appreciate your time and be more than happy to answer any questions that you all have.
Wow, that was incredible. Thank you so much. First of all, like to see those videos, I don't know about the rest of you, but that was really impactful to see that gentleman getting up off the floor like that. Cause I remember, even being younger, watching my father in his 50s have a hard time. Like I remember hearing that, oh, I can't get up off the floor like I used to. So that's amazing to be able to witness that. So thank you for that. That's really helpful.
Yeah, that's the place where I work the most. And the good thing about this arena here is some of you guys, most of you probably will understand that. The reason why I work on the ground is to allow the client to feel safe. Allow their brain to feel safe. That's the big one because I work with the central nervous system. I assess for threat from the visual system quite a bit from people. If there's been some type of head trauma, whether they've had a car accident or some type of a physical abusive relationship. One client in particular, we were working on balance and she would look to the right and she would lose her balance every time. Whether she turned her head or looked, she would lose her balance. And I asked her, I said, we're gonna have to have an uncomfortable conversation, but I'm seeing something and I think I know what's going on. And I asked her, were you ever abused as a child, physically abused, or have you been in an abusive relationship? And her eyes just lit up and she said, yeah, I was actually in an abusive relationship. Why? And I said, I think that that might be contributing to some threat response to your brain. And as we got into it, sure enough, she had told me that she was in an abusive relationship and her ex-boyfriend had grabbed her by her hair on the right side and pulled her hair this way. So anytime she turned her head to the right or actually looked to the right, it was immediately threatening for her brain. And that is stuff that I actually know how to address for people. I am not a clinician. I do not treat. I'm not a medical doctor. I do not treat, cure, or diagnose disease, but that type of stuff I know how to address very easily. And it's a quick fix, something that I just basically lay them on the floor and do a lot of midline crossing and breathing, and they get up, next thing you know, they're better.
Joe, I was going to ask how you're working with people right now because of the pandemic and all of that. Are you seeing people in person or doing it online?
Great question. Both. When the pandemic started, I lost probably 75% of my business and moved everybody exclusively online. I was training people online beforehand, so it was an easy transition. Right now, pretty hybrid. I probably have more clients in person than I do online. I still have a few online, but my gym is also different in that we're a private studio. We do not have group classes. There's only 2 trainers here and a jiu-jitsu school in the evenings. We have 3 rooms. All the rooms have been separated with partitions, with curtains, you name it. So we still have people coming in. I still have some people online, but I'm also transitioning to try to help more people so that I can, transitioning more online so that I can help more people, because I have a goal of helping or impacting the lives of 1 million people with fibromyalgia over the next 20 years.
That's awesome. That is really incredible. And I think even speaking about fibromyalgia, I know you didn't get into that too much, but that's, I think, kind of a misunderstood diagnosis that people have. And even as you were talking, I was thinking about some of my clients and thinking, oh, I wonder if they are misdiagnosed fibromyalgia clients. So I wonder, even just real quick, I know it's a little off topic, like what are the, I don't know, top 3 things or top 5 things that you would say clients with my fibromyalgia have?
That's a great question, great point. Sleep issues are almost always there. I have some type of severe insomnia or sleep issue. There's almost always some type of gut dysbiosis as well, whether that be, constipation, diarrhea, IBS, ABCD, you name it. Those are there. And then widespread musculoskeletal pain that is pretty much unexplained. The process for basically getting a diagnosis of fibromyalgia is a process of elimination, where physicians are ruling out more severe diagnoses like MS. So it's just one where, for myself, I had a diagnosis of myofascial pain syndrome for 6 years before I actually had my 3rd neurologist give me the fibromyalgia diagnosis. So there's a few things that you'll see. But what most of the things are, like the sleep, the gut issues, widespread pain that is unexplained. And it doesn't have to be in the same place all the time too. That is very important to note, because one of the things I always said to my physicians was it's that my pain is consistently inconsistent. And I talk to people all over the world with this condition, and it's pretty much the way it goes for everybody. It's not, like Emily had said that, and actually I've been working with Emily's brother for the past 2 months. He had a couple of places that were pretty specific on him that were ones that caused issues, but he had pain throughout his body in other places too. That's pretty common. Fibromyalgia is one that doctors have a hard time diagnosing as well. And there are still plenty of physicians out there who do not believe that is a real condition. And unfortunately, those physicians then tell their patients that they do not believe that it is a real condition. And as you can imagine, that does a number on people, because if they have a white lab coat and MD after their name, usually their words carry much more weight. And for somebody, speaking from my own experience, for somebody who's desperate for some type of a diagnosis or desperate for some type of a drug or a protocol or something to be able to overcome, we hang on to everything. So when a doctor says you're never going to overcome this, we believe that. And from my standpoint, it is untrue, because I'm sitting here 2 years symptom-free. But when a doctor says that to somebody, that tells me that's also a physician who is not up on the latest research, or doesn't have the time to do that. So I speak with a lot. I'm actually creating an online fibromyalgia support group right now. I'm in the works with my web designer, because I'm tired of having consultations with people and having them tell me, one of the questions in my intake form is, do you have a good support network from your friends or family? And unfortunately, with this condition, it's more often than not that they do not have any type of a support group from family or friends. It's usually they're called lazy, and that they just need to get over it. And I have heard it so many times that I've decided to create my own online support group, so that people have a place to turn to where there's people that understand them, just as you all do in your line of work. I want to be able to create a safe place for people so that they can have a community of people that understand them as well. So it's not just I want to help people. I want to create a community for people to come together, just as you guys are doing with this, where people can feel safe and they can make some new friends that understand where they're coming from, so they don't have to feel so alone in the world.
Oh, that's incredible. And I look forward to you sharing that with our group when you have that ready to go.
Yep, will do.
One last question from me was, like, does vertigo tend to show up with people who have fibromyalgia?
Great question. from my research and from talking to people, I'm finding probably more often than not that there is some type of a vertigo or balance issue with that inner ear vestibular system. And it doesn't matter the age. Normally, that's something I assess for in all my clientele. Normally over the age of 50, I find that that's something that we have to look at. But I'm even finding people as young as 28 right now that are having some type of vertigo or balance issues in association with their fibromyalgia. So it's not every single person, but I'm finding it more often than not. It's pretty common with somebody that's had that diagnosis.
Thank you. And if we have time for like maybe one more question before we kind of move into the last part of our meeting, does anyone have any other last questions?
Yeah, I was hoping
yes.
that oh, sorry, go.
Sorry. Oh, I really just wanted to know, I know a couple of people who would really benefit from your work, Coach Joe, and how can they reach you?
I will put it in the chat. I'll put my phone number and my email address. I'm on social media. Everything is Train Out of Pain. My email address is joe@trainoutapain. But again, I'll put that in the chat. Thank you, Linda. I appreciate that.
Thank you.
Kylie, I'm sorry.
Yeah, it's all right. I was wondering if you could talk more about sleep issues. So many of our clients have sleep issues. And we have like the generic sleep hygiene, try not to look at screens, have a, you know, what is something outside of that kind of like normal box that we might not be aware of?
Oh, you were talking to the right person. So within my health coaching structure, I actually do sleep counseling as well. And I do that because I'm a former insomniac of 15 years. So I have tried literally every single over-the-counter drug, every prescription drug, every protocol, you name it. I have literally tried them all. I now sleep 7 to 10 hours a night, every single night, and have for 2 years. How? The number one, well, there's a couple things. I wear blue light blocking glasses. So you can see the blue tint on these. When I'm on the computer during the day, unless I have natural light like I do now, I wear red lensed blue light blocking glasses after the sun goes down, or amber. That is a big one. Biggest thing is it protects your melatonin levels. Not only is it because of the screens, but artificial light, because your skin, everywhere in your skin are photoreceptors. If your skin is seeing artificial light after dark, that can change your circadian rhythm and decrease your melatonin production significantly. The red lenses that I usually have with me, they block specific frequencies of blue and green light that there's a blue light receptor in your skin, in your subcutaneous fat, or in your arterioles, and in the back of your eyes. Those blue light receptors tell your circadian rhythm to release melatonin or not. The other one, so the red lens blue light blocking glasses, not even close. On my YouTube channel on Train Out of Pain, I have a 7-minute video going over all of the different types of blue light blocking glasses. The other one, which a lot of people don't like to do, is get up and see the sunrise every day. Thank you, Linda, for the thumbs up, and you too, Robin. So I have done that every day for quite a while. There's a couple things that happen here. Biggest thing is, physiologically speaking, that does mountains of things in your body. Biggest thing, set your circadian rhythm, turns on a hormonal cascade from the blue light that is present in the atmosphere at that time. The circadian rhythm being a big one. If you're seeing the sunrise, you're doing a whole host of things. The biggest thing is circadian rhythm, which then throughout the day is going to allow you to build more melatonin. Neurotransmitters like serotonin and dopamine, all of those things are created by early morning light. Okay, so if you're minding your circadian rhythm, which would be in conjunction with what the sun is, then you don't have to worry about it as much. But when you see screens like Kylie had just mentioned, if you see a screen after the sun goes down, that tells your brain it's midday. So I'll give you one more, and then I'll stop vomiting on everybody here. You can use an app, which I use on all of my devices, my laptop, a tablet, which I don't use on my phone, called Iris Tech. Iris Tech is a blue light blocking app that shifts your screen more to the red, but it also has a second advantage, is that it's the only app out there that reduces flicker from all of your screens too. Flicker is a big, big problem. So Iris is out there. You make all of your screens red or reddish. And then once the sun goes down, that will allow you to keep your melatonin levels up as much as possible.
Thank you for spending some of your time today with us at Sage Holistic Health and Wellness Center. If you like what we're all about, please consider supporting our nonprofit organization by making a tax-deductible donation. To do this, you can go to our website at www.sagewellnessctr.org and click on Donate in the upper right-hand corner. We look forward to spending some time again with you real soon. Take good care.